And so we all clearly, along with many of the department heads that are with me, a number of city leaders, elected officials, we are all coming together to put forth the kinds of initiatives that will help us get through this very difficult time. I want to encourage employers and employees who are impacted to visit www.oewd.org/COVID-19 for more information and available support. If you have any questions or concerns and need access to information, you can also call 311. Again, let me reiterate that the time now is not to panic. It's for us to come together. It's for us to follow the directives. It's for us to do everything we can in our respective capacities to prevent the spread of the coronavirus so that we can get over this very challenging time. Ultimately, we will. So we're talking about might be considered long time, but a short-term inconvenience for the possibility of having a more significant impact as it relates to our public health system. So we are grateful for your support. We ask for your cooperation. This will go into effect through April 7th and could be amended to either be shortened or lengthened depending on the advice from our public health experts. So at this time, to provide more details around what this means and how we will be impacted county-wide in San Francisco, as well as the entire region throughout the Bay Area, I want to introduce Dr. Grant Colfax.
Thank you, Mayor. Good afternoon. I am Dr. Grant Colfax, Director of Health for the city and county. As the coronavirus situation continues to change rapidly in our city and region, I want to make sure that all San Franciscans understand that we are entering a new phase in our response. Our response has always been grounded in data, science, and facts. That continues to be the case today. As we look at the patterns in our country, state, and region, we are seeing rapidly escalating cases and serious illnesses due to coronavirus. This requires an escalating response. The evidence tells us that now is the time to implement this step. Today, we are ordering that everyone in San Francisco who can remain at home until April 7th. This is a critical intervention that we know can reduce harm and save lives. The coronavirus is spreading in our community, and we need to slow it down. Over the weekend, Bay Area County health officers from 6 counties conferred and agreed that this step is needed immediately. Based on what we can predict, now is the time to do everything we can to prevent the situation from getting much worse in a matter of days or weeks. Every hour counts. With everyone cooperating with these orders, both locally and regionally, we will be able to adjust to the new rules over the next few weeks. We know that there will be a lot of questions and concerns at the beginning of this. We are committed to providing the most clear and up-to-date information you and everyone needs. We will have frequently asked questions on the SFGov and Department of Public Health websites, bus shelters, and radio ads, and we will continue to update the public through the media. And please do not rush to urgent care or emergency rooms for COVID-19 testing or non-emergency needs. Do not overwhelm the health system or the emergency response systems at this time. We need these services to care for those who are seriously ill. If you are otherwise sick or concerned you may have coronavirus, please contact your healthcare provider. In fact, I urge us not to rush anywhere. With this order in place, you will still be able to get food, care for relatives, run necessary errands, and conduct the essential parts of your lives. You will still be able to walk your dog or go on a hike alone or with someone you live with, or even with another person, as long as you keep 6 feet between you. Grocery stores, gas stations, banks, laundromats, utilities, and other essential services will continue to remain open. Restaurants will continue to do takeout or delivery. Please be patient and kind to one another. Stay informed with the facts and don't propagate rumors or mistruths. Together, we will get through this, and our families' and communities' health will be better protected. During these next weeks, the Health Department, the Department of Emergency Management, and all city agencies will continue to respond to the coronavirus outbreak. This work is essential, and it must go on. For the Health Department and our partners, we will focus our attention on our top 3 priorities to fight the spread of the virus, to decrease harm and save lives. The first priority is to reduce community spread. The virus is here in San Francisco. We must practice social distancing to slow it down. This order escalates that response. Another priority is doing everything we all can to protect vulnerable populations. That means people who are 60 or older who have certain underlying health conditions. These are the people who are most at risk for getting seriously ill and dying if they get coronavirus, the condition COVID-19, which is caused by the coronavirus. Third, we must protect healthcare workers. Across the city, healthcare workers and first responders are courageously on the front lines, keeping our community healthy and safe. We must provide them with the support, protection, and supplies they need to respond to coronavirus. This is the work of public health. Nothing is more important for our community today. We greatly appreciate the way the city is coming together during this emergency. Under the leadership of Mayor Breed, city agencies, businesses, schools, the healthcare system, and individuals are stepping up to do their part. All San Franciscans, please do your part. Abide by the new health order. If you do have to go out, practice social distancing. Stay 6 feet apart from others and wash your hands frequently. Check in on your neighbors. Do not leave children who are out of school with elderly relatives, if at all possible. Do not go to emergency rooms unless you have a true emergency. Take care of yourself and your loved ones and make a plan for how you will manage the changes that are upon us. I know this is a lot to take in, and I and the department are committed to providing all San Franciscans with as much information and guidance as we can to help you do your part. Today's decision was reached collectively, and the entire region is acting as one. We will be developing more detailed information as soon as it is available. And again, please stay up to date by visiting the department's website or SF.gov. And today, if you haven't already, sign up for the text alert service. Text COVID-19 SF to 888-777. That's COVID-19 SF to 888-777. I know today's order is a radical step. It has to be. We need to act now, all of us, to protect the public health. Thank you.
Thank you, Dr. Colfax. And before we open it up to questions, I want to introduce President of the Board of Supervisors, Norman Yee.
Thank you, Mayor Bree. I want to thank you for your leadership, and I want to thank the leadership of all 6 counties coming together to fight this pandemic as a joint effort, because it can't be isolated. I want to also acknowledge my colleagues. As you see there, almost every one of them are here. Supervisor Safai, Supervisor Walton, Supervisor Mandelman, Supervisor Stephanie, Supervisor Peskin, Supervisor Marv, Supervisor Ronan, Supervisor Preston. We're here standing together with the mayor, and I want to thank all of them working in unity with the mayor's office to respond to this. I want to thank the mayor once again to be aggressive about this effort. This is not a game at all. I want our seniors in particular and people that are most vulnerable to take this seriously. We could give orders, but if you don't follow it, it's useless. You all must do your part. We all must do our part. That's what we need to do. Now, the mayor has rolled out many initiatives already to the press, to the public, saying these are some of the things that we're going to do as a city to help the small businesses, to help people that are residents in San Francisco. Those are great ideas that were generated by all of us standing behind me. And I want to say two other things. Those ideas are not the only ideas. And we will continue to find other policies that can help our population in San Francisco while we are all sitting and being impacted by this one way or another, whether it's economic, whether it's emotional, and so forth. So on Tuesday, we're going to continue that discussion to see what else we could do, what other ideas we could come up with. And I'm happy that we will take that initiative to work together. The other thing I want to say is that during this emergency, it's so important that the Board of Supervisors membership, my colleagues, are well informed. So, because as you know, many of the residents come to our offices for information, and we need to communicate back both ways to the Department of Emergency Management, or EOC, to make sure that there's strong links, strong communication that goes on between us, and we're going to work on that also. So I want to thank once again Mayor Bree for your leadership in this. Thank you.
Thank you,
As of
President
last
Yee,
night
and thank you
at
to
5 p.m., there were a total of 273 cases of COVID-19 across our 7 jurisdictions. We know that Santa Clara County is the epicenter of this outbreak in the Bay Area, and we know that COVID-19 is spreading rapidly. Today, we stand together to announce additional legal orders that will apply to all 7 jurisdictions covering Silicon Valley and the core of the Bay Area region. These new orders direct all individuals to shelter at their place of residence and maintain social distancing of at least 6 feet from any other person when outside their residence. The order outlines circumstances under which people may leave their residences and defines essential activities, essential government functions, essential businesses, and essential infrastructure. A few highlights. People experiencing homelessness are exempt from this order, but are strongly urged to obtain shelter, and governmental and other entities are strongly urged to make such shelter available as soon as possible. All businesses with a facility in any of the 7 Bay Area jurisdictions, except essential businesses, are required to cease all activities beyond minimum basic operations. All essential businesses are strongly encouraged to remain open to the greatest extent possible. Essential businesses shall comply with social distancing requirements, including when customers are standing in line. All public and private gatherings of any number of people occurring outside a household or living unit are prohibited with limited exceptions, and all travel except essential travel and essential activities will be prohibited. Mass transit will remain open. People may use public transit only for purposes of performing essential activities or to travel to and from work, to operate essential businesses, maintain essential government functions, or essential infrastructure. People riding on public transit must comply with social distancing requirements to the greatest extent possible. This order will take effect at 12:01 a.m. tomorrow, March 17th, and will remain in place for at least 3 weeks. This order was crafted with the 7 of us and our respective county council. It was crafted in order to balance the public health imperative to take swift action to ensure social distancing with the need to preserve basic infrastructure and essential services to maintain our society. I want to remind you and note, health services will remain open, grocery stores will remain open, pharmacies will remain open, food can be ordered from restaurants or delivery or carry out, gas stations, banks, and hardware stores will remain open, and essential government services and essential infrastructure will continue to operate. We know that the exemptions to these rules are complicated. They're written for health officers with the help of our legal counsel. And rather than attempt to answer specific questions, we will be posting detailed FAQs on each of our respective websites to help the public and everyone understand what we are attempting to do. I recognize that this is unprecedented, and if I thought last Friday's announcement was hard, this one is exponentially harder. But we must come together to do this, and we have done this as a collective of health officers. We know we need to do this, and we know we need a regional approach. We all must do our part to slow the spread of COVID-19 and ensure that our essential services remain intact and open, most especially our hospitals and healthcare facilities. Now I'd like to introduce my colleague, Dr. Matt Willis from Marin County.
Thank you, Dr. Cody. I'm Matt Willis, Public Health Officer from Marin. It's important to remember that social distancing and sheltering at home does not mean disconnection. You can remain connected to the things you need. The essential things we need will be available to us. Grocery stores will remain open. We're encouraging restaurants to remain open for deliveries. You can get your medicine from your pharmacy. You can still visit your doctor if you have an urgent medical need. You can even take your dog for a walk. We can all expect to start feeling some cabin fever, and it'll be important to remember that we can get outdoors as long as we're practicing those best practices in social distancing that we've been talking about. We're not expecting empty streets, but would rather those who go out are out for those most essential trips, to include getting your necessities. Social distancing does not mean disconnection with each other. Let's be innovative and stay connected with our neighbors, our friends, and our vulnerable elders through calls, texts, and online communication. This is a necessary step for all of us to stay healthy together. I'd like to now introduce my colleague, Dr. Erica Pahn, Health Officer for Alameda County.
Thank you, Dr. Willis. This joint action we are demonstrating today in unity to show the importance of how important it is we need to come together as a community and as a region to protect our most vulnerable. We are here to protect the elderly and those with underlying medical conditions. Together, we can slow the spread of disease and protect our parents, our grandparents, and those who need us most to help protect them from serious illness and hospitalization. Thank you. I'd like to now introduce Dr. Aragon from San Francisco.
Good afternoon. My name is Dr. Tomas Aragon. I'm the health officer of the City and County of San Francisco. First, I want to just thank everybody, the health officers, but also all the support that we have been receiving in the prior weeks for everything that we do. We have felt very supported for every action that we've taken, and we're grateful for the continuing support of everyone. In San Francisco, we've had 3 core goals from the very beginning. One is to protect the public, but especially the most vulnerable populations, to protect our healthcare system and our healthcare workers that we need to keep healthy so that they can take care of us. And the way that we're going to do this is by reducing community spread of this virus. Sheltering in place is a core strategy. By staying home, you reduce your risk of becoming exposed, which means that we reduce the risk of transmission, we reduce the risk of illness and severe disease, we reduce the risk on our the demands on our healthcare system, and thereby we improve the health and social impacts in the long term. Thank you again for everyone for all this support. And as Mayor Breed has reminded us, we're all going to get through this together. We've been through tough times before, and we're gonna do it again. Thank you. I'm going to now introduce the Acting Health Officer of Contra Costa County, Dr. Zieli. Thank you.
Hello, my name is Orit Zvieli, and I'm the Acting Health Officer for Contra Costa County. I want to thank our federal partners and state partners, our firefighters, our elected officials, our municipal partners, our nonprofit partners. This is a time where we as a community all have to come together, and all of us have to work together to get through it. We know this is not the normal way of doing business. It's going to take some sacrifice on all of our parts, but we're doing this for the right reasons. We're doing this to help prevent unnecessary death. We're doing it so we can all stay healthy, and together we can remain a stronger community at the end of all of this. I'd now like to introduce Dr. Lisa Hernandez from the City of Berkeley.
Good afternoon, I'm Dr. Lisa Hernandez. Collective action is powerful, and with no vaccine or medicine for COVID-19, our unified actions have the power to slow the virus and to continue to maintain a healthy community. I want to thank my colleagues here and the colleagues in the City of Berkeley for supporting this effort and continuing to protect the community that we serve. I want to now introduce Dr. Scott Morrow, Health Officer for the County of San Mateo.
Hello, I'm Dr. Scott Morrow, the San Mateo County Health Officer. I do not usually address the press in this format, but I have a very important thing to say. My message is I stand in solidarity and in alignment with my fellow health officers in the Bay Area. I ask the community to follow our recommendations, to follow our advice, to follow our orders, to heed our warnings. We are in a rough place, and we are going to have difficult times ahead of us. The measures that we are putting in place are temporary, but they will last longer than any of us want. This is the time to unite as a community come to each other's aid, and dig really deep. Find your best inner self and pull out all the compassion and gratitude and kindness you can. Thank you.